Are all earplugs made the same? Do they all do the same job? Let's talk about it. Welcome back to You Heard It Here with Dr. Gary. Again, from the Final Four here in State Farm Stadium in Glendale, Arizona. Go Huskies. Today's earwax removal video, we look at someone who has an absolute earplug. So the question is, are all earplugs the same? Easy answer, no. A plug of wax does not do the same thing as a custom musician's plug or an NRR or a noise rated earplug. With those, we know exactly how much noise you should be reducing to that ear. Unfortunately, earwax does not work the same. It can muffle your hearing, it can reduce what you hear, but it is not an acceptable substitute for proper hearing protection when attending a noisy event. Let's take a look as we clean this patient's ears out and see what we can find as we reveal the eardrum in all its glory. With our initial evaluation, as we look down the ear canal, we simply see a wall of golden yellow wax. Once we start using the curette trying to get through this stuff, we can see that it's like the consistency of honey. It's soft enough for the curette to go through, but just tacky enough to stick together and help us pull out chunks. We're going to slowly use the curette to remove this wax, freeing up some space so we can use water irrigation to get behind the wax, cleaning it out away from the eardrum. As you can see, the camera is kind of touching a little bit of that wax there. It's coming up off the ear canal floor. Now as we stick the curette down here and we touch the middle of this wax, see how everything kind of moves? That piece is connected. It comes all the way up off the floor of the ear canal. So now we know we can go ahead and use the curette to pull that off. Now that we've got a little bit of room, we're going to use some irrigation here. Water irrigation is perfectly safe as long as you're using clean water and you're doing so in an ear canal that is not surgically altered. Again, now we can see that eardrum, and there's still a little bit of earwax on the ear canal wall. So we're going to go ahead and take this wax off the side of the ear canal wall with the curette. That'll give us a great view of the eardrum. Then we're going to ask the patient to Valsalva. Make sure that the eardrum is moving and that they're able to equalize pressure between the outer and middle ear. This is very important, especially for patients who are about to go flying or a lot of elevation changes. Ear canal looks very clear and healthy. Another successful wax removal. You have to love when a patient has that much earwax. And no, unfortunately, it wouldn't work for hearing conservation for them. But now that their ears are clean, they're hearing clearly and hopefully going to avoid using Q-tips or anything else that's going to cause that wax to build up more quickly. This has been You Heard It Here with Dr. Gary. Thank you for watching. I look forward to seeing you in the next video.